My name is Yasmin Rashid. I'm a doctor by profession and I look after the Thalassaemia Society of Pakistan. I'm basically working there as a general secretary, and it's an organization which has a large number of patients as a part of the organization, and basically we are looking after the needs of our patients, particularly their treatment and their management. The reason of my involvement is that initially I started working for the prevention of the disease in Pakistan, and because I had initiated the prevention of the disease, a lot of people started coming to me wanting to find out what was the latest in treatment for thalassemia patients. I got a lot of my friends involved, particularly pediatricians, and we started working with those patients. When I started working with those patients, I started realizing there was very little awareness in those patients about their rights. So as an organization, we are working to create awareness about thalassemia in Pakistan, and we are advocating their cause so that the government takes up their responsibility. Basically, the key challenges as usual is, of course, the government's attitude. What is extremely important is that when we started talking about thalassemia initially, there was a very poor response from the government, because they said our priorities are different. We're more concerned about infectious diseases in children dying of diarrhea, and they were not bothered about this genetic disorder. But over the last, now it's nearly been 24 long years that we have been advocating the cause. Now thalassemia has become a center of attention because of our advocating it, and now the government has started paying attention not only towards the prevention of the condition in Pakistan, because it's the most commonest genetic disorder there, but also it has now started taking up the responsibility of the patients, and better treatment centers are now being set up. Now our latest challenge that we have at the government is the price of the drugs which the patients use, which of course we want them to become orphan drugs, and we want that the government should support them, subsidize them, so that the patients could afford that medicine. Because although I'm a doctor, but I still believe that the patients have their rights, and because I've been working with patients, and I realized, particularly in a country like Pakistan, the patients were never aware that they could also speak up for themselves. And I thought I would like to give them a voice, and I've always encouraged this, and that is why one of the reasons of joining the International Alliance of Patients organization was that this organization was raising a voice for the patients. And it's extremely important, if you want optimum treatment being given to patients, then it's extremely important that the patients should be aware about their rights also. As a physician, I definitely believe in universal healthcare, because that is what is the need of the day, particularly in a developing country like Pakistan, where there's a very small amount of budget from our GDP given towards patients. I think it's extremely important that the government should be made aware how important it is, if they want any development in their country, that the health becomes a priority. And that is why I definitely believe in universal healthcare. I was also one of the authors in one of the largest provinces in Punjab about the Healthcare Commission Bill, which actually works towards the rights of patients, which was initiated in 2008, and we have been constantly advocating its implementation. So basically all our work is towards universal healthcare. Whatever work we are trying to do is create awareness among the patients how important it is for them to get united and stick up for themselves and speak up for themselves.